Okay, good afternoon, everyone. Hope you're all doing well. So we've had vision, we've had audition and hearing. So as Daisy mentioned, I'm going to talk to you a little bit about the sensation of touch and potentially the unlikely pairing of neuroscience and art and design. Very well aware that I'm the only thing separating you guys from lunch as well. So I have a tendency to waffle on, so if you feel I'm going in there on a bit of a tangent, then please just send me an appropriate hand gesture from the back of the room and I'll wrap things up. Okay, perfect. So without further ado, so not something that I usually encourage during my talks, but I'd like you all, please, just for a moment to close your eyes and to drift off into your happy places. Okay. Just fully immerse yourself in that experience, in that environment. Okay. Now open your eyes for me. So some of you may have been transported off to a tropical beach or maybe a beach around the Gower area. Others of you may have been snuggled under a cozy blanket. But the chances are that you could almost feel the sand between your toes, or you could feel the kind of warm, fleecy fabric that surrounded you. And this just really shows us how powerful that sensation of touch actually is. It's really magical, really powerful how it can evoke such strong memory traces that have quite emotional connotations in some of us as well. So just imagine being able to harness that as a powerful tool in the fight against dementia. So being the conference that it is and the context of it all, I'm sure I don't need to labour the point of why this particular fight and the importance of it is so crucial. And to be quite honest, the numbers do speak for themselves. So the numbers in front of us here just reflect the state of play in the UK. But you can see the increases in severity, in prevalence of dementia, and also a rise in the associated costs as well. So this really is something that's pivotal. It's on the forefront that we deal with this fight against dementia globally as well, not just in the UK. Recent statistics are telling us that it's about £604 billion spent on dementia care, I think was the latest estimate, with the prevalence doubling every 20 years. So it's by no means a trivial concern. Okay, so with all of that, with the crucial issues that we're all facing in this global healthcare pandemic, we really do have to start thinking about aging well and living well with dementia as well. So it's something that's really been pivotal to us in the design of this piece of research, is thinking about standards of living. Okay, so we want people to be living longer, but we want to not just add life to years, we want to add life to years, not just years to life. Okay, that's been very important to us. We want to align ourselves with the message from the Older People's Commissioner from Wales, and obviously loads of social policy that goes along with that too, really focusing on having people age and quality of life being as high as it possibly can for as long as possible. Okay. So the research I'm going to document to you all today is still in its really, really early infancy. It's very early stages. But what we were thinking is that with time, with repeated investigations, we can really enhance the knowledge that will be applicable to clinicians, to those who work in health and social care, and also being able to influence policy as well further down the line. Because the approach that we're taking is really designed to enhance neural stimulation, get our neurons firing, enhance cognition as well, to really impact on quality of life. Okay, so how exactly do we plan on going about this? How are we trying to enhance the standards of dementia care? So we are going to be talking very much about sensory textiles. Is that a concept that's familiar to some of you? Sensory textiles, yeah, okay, perfect. So we are basically dealing with fabric. I'll show you some examples on the next slide, but fabric pockets that have really been shown in individuals with various stages of Alzheimer's disease to enhance well-being, stimulate communication, and to also reduce agitation in these patients, even towards the late stage of the disease. So we know that touch can be absolutely integral even at that late stage of the disorder. So care home staff and family members of patients attest to this. So it's something that has anecdotal evidence to support it, but it's really lacking in terms of quantified information, scientific evidence to back it up. What the care home staff and the patients' families are saying is that the more personalised these textiles are, the better the results are. So the more well-being enhancement, the less agitation these patients are actually facing. So that's sprung to mind the prediction that we would then have, that what we think is happening is not just you're interacting in a touch capacity with these fabrics and it's evoking responses in the brain in terms of tactile and haptic exploration. We're thinking that if you are bringing to mind these emotional and personal memories, that is really the root and the origin of the better well-being, the better communication, and the lower rates of agitation in these patients. So that's exactly what we wanted to test, whether these tactile, sensory tactiles were actually able to evoke such emotional memories within us. So these are our sensory textiles that we actually used, and we've got 3 different levels here. So you can see on the left-hand side, there's just a really basic calico fabric. Not a lot going on there, really is quite basic, not a lot to touch and to play with there. The intermediate one in the middle has a smooth side that you can't see there, it's almost silky, and then has a rough kind of coarse textured fabric on the top there. And then the most complex one on the top, you can see has all the bells and whistles going on. We've got some level panel there on the front with raised sections, faux fur, buttons, you name it, we've thrown it at this sensory textile. So what individuals were asked to do when they were inside an MRI scanner in order to look at the brain responses was to interact with each of these 3 sensory textiles and bring to mind what they evoke. So we've asked them to really think about the memory traces, any events that were evoked by touching the individual parts of the sensory textiles. So as I mentioned, the key aim of this was to go from that anecdotal evidence to find some kind of scientific support for the use and the value of these sensory textiles. We did this first in a group of younger adults and a group of older adults for an age-related comparison. Just as a proof of concept, we do plan further down the line to look at various stages of cognitive impairment and dementia as well, but we wanted this to be our kind of test of feasibility to see if it would all kind of go to plan. And then what we predicted, as I've alluded to already, that once we looked at the MRI brain responses, we wouldn't just see these typical sensory motor activations in the brain. We would very much see if there was evidence of personal relevance and of emotional kind of memory traces coming to mind, that we would see key hubs in medial temporal memory regions, and also those indicating personal relevance or salience as well in these different brain networks. Okay, so on top of what I've mentioned about interacting with the sensory textiles, we also wanted to look at basic tactile processes. And we did this using something that looks very much like a computer mouse, but it has 2 little probes that deliver vibrations where the fingertips rest. Okay, and with that, we're able to do a lot of tests based on these types of vibrations. The first one you can see at the, if it works, yeah, panel A there is a basic reaction time test. So as soon as you felt a vibration under one of your digit tips, we'd ask you to press a button as soon as you've done that to measure how fast those responses were. We also gave participants tests where we asked them to discriminate between 2 vibrations, so to decide which one was more intense or stronger than the other. So this relies upon different tactile processes to the basic reaction time, and we did this in a range of circumstances. So you had a test where you just had the two stimuli to discriminate between, and then we also gave participants a priming kind of advanced notification of what they would receive in the test scenario, where we did that by delivering a priming stimulus to either one digit or to both digits, which I'll refer to as single or dual site adaptation. Then we had the MRI, so this was done outside of the MRI. Then we popped our participants into the MRI scanner to interact with the sensory textiles. And we also gave them memory tasks as well, again, in the same way that we wanted to know a bit more about the basic behavior responses in terms of tactile processing. We also wanted to know about their capacity for different memory traces and to be able to recall them as well. So in the first instance, we have our semantic condition. So semantic memory essentially revolves around basic general knowledge and factual information. Okay, so in this particular example, we have an image. It might be quite small to you guys back there, but it's an image of a train. And the question that we asked participants was, what engine powered the first train? You've got the options of electric, steam, or I don't know. And then the participant has to choose the correct answer, the answer that they want to select, before it will move on to the next trial. So very general knowledge, factually based. Okay. We also have an episodic condition in the middle there, and this relies very much on details that are present within that image that the participants have just looked at. Okay, so we're asking there about the colour of the front of the train, what colour that was. I think it's red and green, or I don't know. And you guys have the advantage of seeing it in front of you, so the correct answer is red in this instance. And then lastly, we have an autobiographical condition. So this was particularly important to us. So we're asking individuals to delve into their own experiences and their own memory traces. So this we felt might be particularly important in terms of emotional relevance and that kind of personal angle that we're going for with the sensory textiles. So here, rather than giving you any questions to answer that are right or wrong, we have the request to bring to mind the last time that you were on a train, or a time that you remember being on a train, and documenting how vivid that experience was. Okay, so if it was very vivid, somewhat vivid, or I think the last one is not at all vivid. So various stages there to tell us a little bit about your memory traces, because not all of us will remember things to the same extent as others. So that vividness of experience might tap into how readily you're able to conjure up a mental image when you're interacting with the textiles. And then we had a control condition just to make sure that individuals understood the task instructions. Okay, so some very preliminary results. I can't talk today. We've got the basic tactile information up first. So we can see in terms of reaction time here to the tactile task, we've got our younger adults in blue and our older adults in this orange colour here. And you can see that the response times were longer in the older adult group, indicating that they were slower to respond. That's something that we absolutely anticipated. They also are slightly more variable in their responses, so they weren't as consistent in their responses as the younger adults. And Andrea talked a little bit about individual differences and variability. That's something that we very much expect within not only patient groups, but in the healthy aging process as well. So our older adults not performing so well as our younger adults in those types of tasks. However, that is absolutely not the case for some of our more complex amplitude discrimination tasks. So remember, I was talking about the dual site and the single site adaptation. So these metrics, these tactile tasks rely more upon the basic integrity of brain function and neural plasticity. So basically the building blocks of what keeps us firing on all cylinders and keeps us cognitively flexible. So higher integrity of brain function obviously is going to be better for us. So the fact that our younger adults and our older adults were performing these tasks to the same extent shows us that we can't just rely on a kind of heuristic thinking that aging is based upon decline. It absolutely is not, even in the tactile domain. We know a lot about that in vision and in hearing, but it's great to also add that piece of information to the pile in terms of our tactile processing as well. So older adults just as capable as our younger adults in those domains. In terms of memory, in the memory tasks that we gave individuals, on the bottom there, we have episodic memory being impaired ever so slightly in our older adult group in terms of speed of processing compared to our younger adults. But again, we have a bit of an improvement here in terms of our semantic information. So those facts and figures actually recalled a lot better in our older adult population compared to the younger adults. So again, the message there that it's not just about decline in the across the board in the tactile domain. We can very much also see improvements in memory function with aging. And then last but not least, I don't know if you can see that back. Can I move this? Will I make it all crash? Sorry. Yes, so we've got the brain data there behind the Zoom. You've got basic, intermediate, and more complex results there. And you can see the blue bars are showing us that we have very similar processing of each of those three sensory textiles in the younger adults. So the younger adults are not processing those very much differently to each other, despite the various complexities. But the older adults were really fixated on the basic textile, so the basic calico one, followed by the most complex one, and then the intermediate one. And what we saw when we looked at the brain data for this was a pattern that reflected the somatosensory system, so those basic touch areas in the brain. But we did also notice those that were linked to higher order visual processing as well, which is very interesting because participants reported that they mostly had their eyes closed. So why is the visual system becoming involved? Then when we looked at some of these subjective reports that we asked our participants to give to us, most of our older adults were actually saying that they were trying very hard to visualize what these textiles were looking at. So we purposefully didn't show them what they looked like, but the visual cortex was obviously lighting up, becoming active because of this kind of visual imagery that the participants were having, imagining what they were touching, what it looked like. And we've also got our classic medial temporal hubs that we can attribute to emotion, that we can attribute to personal relevance as well. So we definitely saw within these responses, not just the basic sensory processing, but also that higher level processing that links into the processes that we were actually hoping we would see if our predictions, our hypotheses were correct. Then we delved a bit deeper into the basic sensory processes with the basic textile and the older adults. And what we can see here is that they were very much interested in the basic textile, and we can see regions of the bilateral superior temporal gyrus there lighting up, which is really key in personal relevance and introspection, and also problem solving. So if our adults were trying to make sense of these sensory textiles, to evaluate them, to find some kind of personal relevance, then this brain data makes a lot of sense to us. So it's kind of piecing the puzzle pieces together, trying to work out exactly what older adults are doing. And it does look like they're trying to identify personal relevance and meaning from these sensory textiles. And it's a lot harder to do that with that blank canvas than it is when you've got all of these things to play with and bells and whistles that you can identify easily, and you can think, this foam fur panel feels like a pet that I once had, for example. There's not a lot to go on, so it's struggling with that blank canvas is what we think is happening here. So pulling everything together, the relevance of this, it's still very early days. We do think that the outcomes, the relevance of this particular piece of research, showing that there is emotional relevance attached to these textiles, could be very important to us, for patients, for families, and the people who are providing their care as well. And the knock-on effects of this in terms of economic and societal change could be absolutely revolutionary. And also on a personal centered level, we have the ability with better care, better communication, less agitation in patients to allow things like more time between children and their grandparents as well, which obviously cannot be underestimated. So what's ultimately a very simple concept could have really far-reaching impact here. And essentially the future of dementia care could revolve around touch and quite literally be in our hands. Thank you very much.